Namaste, everyone. Today, we are going to start the topic gastrointestinal agent and its classification. So, what is gastrointestinal agent? It is an agent which helps to relieve from gastric disorders happen in our GI tract, GIT, gastrointestinal tract. So, for that, we can, according to Indian pharmacopoeia, it can be subdivided into acidifying agent or acidifier, antacids, protective, absorbent, and laxative cathartic. These are the some classification of gastrointestinal agents. Classification of inorganic gastrointestinal agents. So here we know that this whole unit come under inorganic pharmaceutical chemistry. So first of all, we know about inorganic gastrointestinal agent and how it's work. So it work to maintain the pH level of intestinal. It protect in inflammation. It help in inflammation. If inflammation happen inside the above stomach region, then it will help to minimize the inflammation. It if some toxic substance is secreted in our stomach, then it helps to absorb that toxic substance and give a body a good environment. Cathartics and laxative also help in inflammations. So acidifier. Ammonium chloride is an example of inorganic acidifiers. Dilute hydrochloric acid is also example of inorganic acidifiers. Antacids, sodium bicarbonate is an example of antacid, inorganic antacids. Ammonium hydroxide gel, magnesium hydroxide mixture, these are antacids which we are generally taken in the form of tablets. Those who are suffering from a gastric problem or acidity problem. Nowadays, a maximum people, due to their lifestyle problem, they are suffer from these gastric disorders. Some are suffering from constipation, some are suffering from passing stools not on time, some are suffering from hyperacidity, some are suffering from acidity, some are suffering from gastricity. So there are various types of disease with disorders happen inside our GIT. Cathartics, magnesium sulfate used as a cathartic, sodium orthosulfate used as a cathartic, and antimicrobials, potassium permanganate, boric acid, hydrogen peroxide, these all are used as antimicrobial agents, acidifying agents, antacid agent, or cathartics. So here are some disorders happen in our GIT disorders. Hyperchlorhydria and hyperacidity. What happened? Hyperacidity is causes. See, nowadays gastric problem is normal. When it increases, the concentration of acidity increases inside the stomach, and it come out from the stomach and mix with the fluids, extracellular fluids or intracellular fluids, then it causes hyperacidity. That means that it mixes with blood and reaches the whole body. Then we feel lots of problem. Sometimes a chest burn is there, sometimes bloating is there, sometimes you feel heat inside the body, your heart rate will increases. Lot of symptoms are there for the hyperacidity. When an excess secretion of acid take place in the stomach, this cause imbalance in acidic enzyme ratio. Acid and enzyme ratio is get disbalanced, and thereby the final leading is hyperacidity and ulcer. Antacids are commonly used for treating the hyperchlorhydria or hyperacids. Hypochlorhydria. What happened? Our body need a minimum amount of acids and enzymes to maintain the balance, to maintain the metabolism of human body. Then what happened when it secretes in less amount? If we need 10 gram, suppose if we need 10 gram of acid in a particular time, and it secreted 5 gram only. What happened? That time body needs some extra acids, and if not got, then that time also our body get disorders. So that is called hypochlorhydria. Whenever inadequate secretion of acid take place in the stomach, this causes hypochlorhydria. Acidifying agent and acidifiers are used to treat this hyperchlorhydria. So for treating hyperacidity, we use antacids, and for hyperchlorhydria, we use acidifying agent and acidifiers. Acidifying agents and acidifiers. To increase the acidity level of GIT, to increase the acidity level of GIT, because we know that in hypochlorhydria, the acid concentration in GIT will decreases and we need some extra acid. So the acidifying agent, which activate the acid secretion in body, or acidifiers, a compound which activates or acidify a particular gland so that it can secrete a proper amount of acid needed for a metabolic process. So what are acidifying agent and acidifier? It is a drug or agent. It is a drug or agent which are used to increase the metabolic acidosis. Okay, so it is a type of drug or agent which increase the metabolic acidosis and gastric hydrochloric acid. Means whatever the hydrochloric acid is needed, it increases by acidifying agent or acidifier. They are also known as acidifying reagent or acidifiers. Dilute sulfuric acid. If we take dilute sulfuric acid, then it can be increase the metabolic acidosis and our body get proper function after taking this. Antacids. What is antacids? It is a drug or substance which are alkaline substance and used to neutralize the excess acid in the stomach. Already we know that antacids are taken when our body suffer from hyperacidity. Means concentration of acid is increases already in our GIT. That time what happened when the concentration increases, then we need some compound which neutralize that acid concentration or which dilute that acid concentration so that our body get comfort. So antacid is a drug or substance which having alkaline nature, because already there is a high concentration of acid. So that time for neutralizing high concentration of acid, we need alkaline substance. So antacid is a alkaline compound, and when we take antacid, it neutralizes the excess acid present in stomach and patient get relief. So what are the compounds, what are the salts we are using for as a antacids? So sodium bicarbonate, ammonium hydroxide gel, magnesium bicarbonate, milk of magnesia. There are lots of salts nowadays available in market for in the form of antacid. So if you are suffering, if anyone in your society or in your family is suffering from hyperacidity or excess of acid secretion in his and her body, that time also you can prescribe and you can suggest him that you can take antacids tablets. Absorbent and protective. These are the chemically inert substance. These are the chemically inert substance. What is inert substance? A substance does not react with another, which are used in the treatment of mild diarrhea and dysentery of GIT. Gastrointestinal tract. If our body is suffering from mild diarrhea and dysentery, mild diarrhea and dysentery, that time we take protective and absorbent to get relief from that mild diarrhea and dysentery. Because they absorb the protective and the absorbent, they have ability to absorb gas, toxic substance and bacteria, the bad bacteria present in our GIT. So bismuth subcarbonate and bismuth subnitrate and milk of bismuth are used as a protective and absorbent. Cathartics. What is cathartics? Cathartic may be defined as a drug which bring about defecation. They are beneficial in constipation for expulsion of intestinal parasites. So whenever we feel constipation, we then that time doctor suggests us to take cathartics. That time in the form of magnesium hydroxide, sodium potassium titrate, they prescribe a salt and we take and we get relief from that. Purgative is also a type of cathartics which act similar and mild in their nature of action. It's similar to just like a cathartics. There is very less difference between cathartics and progressive. It's similar work. So for constipation, we can prescribe this also. Potassium titrate, a salt used as progressive. Laxative are the mild type of purgative. It is also mild type of purgative that give rise to same effect but vary in nature and mechanism of action. So purgative and cathartic have same mechanism of action, while laxative have different mechanism of action in GIT. So laxative work different way, and progressive and cathartic work different way. Magnesium sulfate and sodium phosphate are the examples, some few example of laxatives. Now we come GIT and GIT diseases. So the digestive system in the gastrointestinal tract, it started from esophagus and end by to anus. Here we can clearly see that it end by anus and has started from our mouth. It started from mouth and in from anus region. So GIT gastrointestinal tract start from this mouth, then come to esophagus, then come to stomach, then goes to small intestine, large intestine, rectum, then anus. The main portion of GIT tract include stomach, small intestine, large intestine, and the rectum, with the excretion of exit anus. Whenever the function of GIT goes wrong, the disease occurs. So, whenever GIT tract function get abnormal, that time our body suffer from disease or disorder. So, what are the types of disease and disorder of GIT? Already we know that hyperchlorhydria, hypochlorhydria, and there are other also. We suffer from constipation, we suffer from diarrhea, dysentery. So these are the diseases of GIT. Disease of GIT. So see here, already we discussed about hypochlorhydria, inadequate secretion of acid in the stomach, or hyperacidity or ulcer, excess secretion of acid in the stomach. Then we have diarrhea, constipation. So these are some few diseases of GIT. Detailed classification. Already we know about acidifying agents. Now we go for the detailed ones. So in next class, we read this topic. So today we stop here. So and in next class, we started from acidifying reagent and acidifier in detail. Thank you for watching us.